Obviously, the impact of a mother's mental health problems can have a significant impact on a child's development. It's all about relationships. The early years of a child's life are crucial in terms of their future social, cognitive, and physical development. And that occurs in the context of relationships, both within their family and the wider environment in which they grow up in. And that relationship with their mother is their first relationship, is a primary relationship. And anything which impacts on a mother's ability to provide that sensitive, responsive care to their child, such as a mental health problem, can have a significant impact. We know, for example, that having a mental health problem like postnatal depression can impact on your ability to pick up on and respond sensitively to your child's cues, their desire for attention. And because of that, it's really important that services are able to respond early, to identify women who are experiencing problems, and to support them to be able to provide the most optimal relationship for their children. We know from the evidence that women most at risk of developing mental health problems, either during their pregnancy or in the months following, are those women who have a prior history of mental health problems or develop symptoms during that time period. One of the most important things to improve the outcomes for women experiencing mental health problems during pregnancy is early identification and support. And that's where our universal services such as midwifery, health visitors, GPs have a really crucial role to play, because these are the people coming into contact with these women. We also know that providing women who are identified with problems social support or structured psychological therapy, for example, cognitive behavioural therapy or interpersonal therapy, can be effective in helping to address their problems. The key thing for staff to be most effective in terms of identifying and supporting women with mental health problems is that they're skilled to be able to do so that they have the skills to recognise, perhaps as well when someone's not necessarily disclosing something, but they can pick up that something maybe not quite right, and to be able to support them to promote their mental health and wellbeing, or to access those services that may be able to provide them with the specialist treatment they need. Attachment is the term that's used to describe the developing relationship or bond between a child towards their parent or primary caregiver, that most significant first relationship in their life. Babies and children, when they're tired or they're unwell or they're scared, will look to that person to provide them with safety and comfort. Babies and children don't know that there isn't a big scary monster hiding around the corner that's waiting to eat them. They need to feel that there's someone there to look after and care for them. And that's what they're looking to elicit through the behaviour, is just to say, I need you. We know that those children who have experienced sensitive, responsive and consistent care, someone who's always come to their need when they're saying, I'm scared, please help me. We know that those children tend to have more positive outcomes. It's associated with resilience, it's associated with emotional regulation, so that ability to control your own emotions when you're upset and to contain them. We also know that children who experience neglect or abuse can learn to be scared of the person who's meant to take care of them. They learn that the world is a scary and bad place and no one comes to help you. And this is really the kind of attachment style that services and the work that we do is trying to help avoid. Promoting secure attachment is something that is actually relatively simple. The evidence tells us that from the very start of life, that actually simple things like giving parents information about their baby's capacity through things like the Brazelton neonatal behavioural scale helps them to understand their baby and understand and appreciate that interaction. We also know that skin-to-skin contact is really important, so from the earliest moments of life, so placing a baby directly onto your skin. And we can also support parents in choosing equipment that also helps to promote secure attachments, such as soft baby carriers, which again promote the close physical contact, and front-facing buggies, so you can interact with your child and you can talk to them and see how they're responding to the world. Universal services have a crucial role to play in terms of routine inquiry. It's really important because we know from the evidence that routine inquiry about domestic abuse, so asking women if they're experiencing domestic abuse, can increase rates of disclosure, so women saying, yes, this is happening to me, at particularly vulnerable periods of their life, for example, during pregnancy or if they're experiencing mental health problems. Universal services do have a really important role to play following disclosure of domestic abuse. It's important to bear in mind that this might be the first time that someone's ever told anybody about their experience. So universal services have a really important role in terms of helping someone to make the best choices for them and their children, and also to help advocate on their behalf and help them get into services which specialise in supporting people who are experiencing domestic abuse. Children can be exposed to domestic abuse in a variety of ways. That might either be, for example, through observing or overhearing abuse that's happening to one of their parents, or it can be that they directly experience abuse, and that can be across the range. That's physical, emotional, sexual, psychological abuse. And again, that can range in a spectrum from a one-off incident to chronic, recurring incidents of abuse. We know that children exposed to domestic abuse are at much greater risk of experiencing poor outcomes across the range of development, psychologically, socially, cognitively, and that can have a big impact in terms of their future life and their attainment. And that the longer this gap develops, the harder it is for us to help these children get to the point in life which they could have been if they hadn't been exposed to domestic abuse. But it's also important to bear in mind that not every child who is exposed to or experiences abuse has poor outcomes, and that's why services are a really important role to work with individual children, to work out what their needs are, to work out the ways to best support them rather than try a blanket approach. And in terms of the specific interventions that these might include, things that seem to be effective include psychological therapy, play therapy, and advocacy, promoting the rights and well-being of the children and family.